Hey guys, it's Hina here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And today I want to talk to any of you guys who either personally or know of someone, friends, family, acquaintance, that has had colorectal cancer and recently went under treatment, including radiation, that now is having significant bowel difficulties. I recently had a video consult with someone who was expressing that, while it was horrible to kind of be diagnosed with the rectal cancer that she has, that, while she is cancer-free at this point, she is still having a lot of issues in terms of being able to have a bowel movement. And every time she goes back to her oncologists and other physicians and tells them, hey, I'm still having a really hard time having a bowel movement, they kind of look at her and she's like, they don't say this directly, but I feel as though I should just be appreciative of the fact that I'm alive, and that I'm cancer-free, and that all of the other things shouldn't be that big of a deal. And I'm here to tell you, if you guys, any of you know someone or you personally are suffering from this, I totally can sympathize in terms of the amount of patients that I have had that have expressed that this is going on and no one knows what to do. And so I'm here to tell you what could be going on, and then I'll tell you how treatment can help. So basically, anytime you have radiation treatment in the area of the rectum, anal, colorectal area, you are going to be affecting all the tissues in that area. So not only the cancer cells are going to be affected, but all the other cells that make up muscle, tissue, something called fascia, all that kind of stuff. So if we look at the pelvis, all right, so this is the spine back here. This is the pelvis, which many people think are the hips, but it's not. Your hips are actually down here. So if my hands can mimic the hips, that's where the hips are. All right, this is kind of where the sides of the pelvis are. And if we look to the back, you can see that here is the tailbone right in through here. Now, if we look underneath this area, this is a female model, but if we look under here, this is the pelvic floor right in through here. And right here is the muscles that surround the anus, all right? So this is where, when you're having radiation and you're getting targeted treatment here, not only will the cancer cells be affected, but all these cells that make up the tissue here. And what often ends up happening is that this becomes really tight and restricted, and it forms scarring because of the radiation. And over time, that scarring can become tight. It closes the opening and the flexibility of the sphincter muscles, and then it's very difficult for bowel movement to come out when this is not as flexible. And so, I hear everything from it's extremely painful to have a bowel movement to I can't have a bowel movement. I have to take, laxatives and stool softeners, and I really have to change my diet in order to have a bowel movement, to even to the point where, people have said the only way I can have a bowel movement without feeling like I'm in so much pain is if I stand and I have a bowel movement. And then, I clean myself off in the shower. So it can be mild to, hey, I have some mild constipation issues, to extreme where some people are having bowel movements in standing because it's just way too uncomfortable for them to even be able to have a bowel movement in sitting. Now, I know that seems extreme, but those are the consults that I have. And that's what we can see as a side effect of this. And then when we talk about, hey, you should just be appreciative of the fact that you're cancer-free or that you're alive and you're doing well. I mean, this is a big quality of life issue. If you can't have a bowel movement and you can't eliminate, and that becomes an obsession now with your life, you can't enjoy the things that you want to do. You can't go out and simply go have drinks and dinner with friends and enjoy your quality of life without knowing that, hey, I have this issue and what am I going to do if I have to use the bathroom? So I hear you guys. So hopefully that makes sense now for some of you guys are wondering, like, what is going on? Well, now what do we do about this? So the treatment involves really trying to get a lot of this musculature flexible again and mobile again. And so if all of this is tight, you can see that it's going to be very hard for something to come out of, a fist that's closed. So what we do here at our clinic, we actually work on all of these muscles that have become tightened, restricted, scarred down, to then allow the flexibility for this musculature to allow it to become supple, more mobile, and it allows the stool to kind of come out. Now, the other thing which ends up happening a lot of the times that I, personally that I have seen as well as my colleagues, is that when you are having difficulty having a bowel movement because it's painful, you tend to grip not only these muscles around the anus, okay, these are the pelvic floor muscles, but you start to grip around the entire kind of gluteal area. And so oftentimes what accompanies that is that many people will say, I feel so sore and tight around my hips as well. And it's because gripping all of those muscles around the hip and the pelvis, including your pelvic floor, has kind of become this compensatory thing that you end up doing to almost like divert away from the pain. Or maybe you are even not necessarily just with the bowel movement, maybe you just are in pain because you've had treatment there. All right, so guarding of a lot of these muscles will end up happening too. So these are some of the things that we also work on in addition to this is, hey, let's get all of this situated. Let's get the guarding less, because that's gonna affect not only feeling like you're tight and uncomfortable there, that's actually going to affect your hip and the way your hip moves. And over time, the hip can then downstream down the line, maybe a year or two, maybe a couple of years later, ends up becoming a problem. Not only that, it can also affect the low back, because your low back will start to tighten over time too if your hip and your pelvis aren't moving the way that it should because of all this tightness that has kind of developed. So I hope that makes sense to some of you who might be going through this, or some of you who know someone that's going through this. This is showing them this video, sharing it with them can be extremely helpful, because then they feel that there is somebody that understands what is going on. Couple of ways that we can help. Obviously, if you live in and around this area, then you can come in and see us. Like I said, this is something that we do and we work on all the time in terms of the pelvic floor, the hip, the spine, things like that. And like I said, you can share this with a loved one. The other thing is, if you do not live in and around this area, you can't get to us readily, then down below in the information box, we actually have two things. Number one, we have our video consults that we do for our patients that can't get to us. And it's an hour-long consult where we'll talk about everything that's going on, help you put the pieces together and help you understand what you might be needing to do, recommendations, potentially people you need to see. The other thing is we actually have a program that's called the Pelvic Pain Solution. We have one for males as well as one for females. That can be extremely helpful to learning what you guys need to do at home and what you can start doing at home to start getting this improved. So that's going to be down below in the information box if you click down below. And then all of our information for our clinic is actually down in that information box below too. But you can easily go to our website, which is rebalancept.com. That's REBALANCEPT.com. Lots of helpful blogs, information about our clinic. And for those of you who have found this helpful, don't forget to subscribe to our channel, because we have lots of other helpful information that kind of will tie into all of this stuff that you might be going through. So I hope this video was helpful, and I hope I've made a difference for some of you just by making you feel better that there's someone there that understands and is here to help. So take care. Have a wonderful day.